7 symptoms that indicates you may have diabetes. Diabetes is extremely dangerous and deadly condition, but long before we are diagnosed with it, the body gives away signs that our blood sugar level is very high. Because our unhealthy lifestyle, the number of people that are suffering from high blood sugar is dramatically increasing. The only way to stop this is to educate ourselves and watch for the signs that our body is providing. Before we start, make sure you have subscribed our channel and the bell icon is turned on to get notified for our upcoming videos. Then let's get started. 7. Blurred vision. High blood sugar levels in diabetes causes changes in fluid levels in the lenses of our eyes. When blood sugar levels elevated, fluid is drowned from eye lens tissues into bloodstream. This can lead to swelling or changes in the shape of the lenses, which affects the ability to focus properly. Fluctuations in blood sugar levels can affect the refractive index of the lenses. This results in difficulty focusing on objects and lead to blurred vision. Prolonged exposure to blood sugar levels can damage the small blood vessels in retina. It's the light-sensitive tissue at the back of our eyes. This condition is known as diabetic retinopathy. This can cause bleeding, swelling, and the growth of abnormal blood vessels. Diabetes also affects the tear glands, leading to dry eyes. Dry eyes causes to blurred vision. Regular eye examinations are crucial for us to monitor for signs of diabetic retinopathy. 6. Increased hunger. Increased hunger is medically known as polyphagia. It's a common sign of diabetes. The body's cells become resistant to the effects of insulin. When cells resist insulin, glucose can't enter them effectively. It leads to a buildup of sugar in the bloodstream. It triggers hunger signals in the brain. When glucose can't enter cells to be used as energy, the body perceives itself as being in a state of starvation. Increased hunger in diabetes can be viewed as a compensatory mechanism by which the body attempts to overcome the energy deficit caused by impaired glucose metabolism. This increased appetite can contribute to overeating. You can manage your increased hunger by following a balanced diet, monitoring carbohydrate intake, spacing meals evenly through the day. 5. Slow wound healing. Diabetes damages blood vessels, impair blood circulation throughout the body. Proper blood flow is crucial for delivering oxygen and nutrients to wounds. Diabetes causes peripheral neuropathy. It's a condition characterized by nerve damage, especially in the feet and hands. Peripheral neuropathy can lead to decreased sensation in these areas. H. From injuries. High blood sugar levels create an ideal environment for bacteria to thrive, increasing the risk of wound infections, and infections will delay wound healing. High blood sugar levels interfere with the body's natural healing process. Elevated glucose levels can impair the function of immune cells, such as white blood cells, that play a crucial role in fighting infections. Prevent slow wound healing by maintaining good blood sugar control, practicing regular foot care, protecting vulnerable areas. 4. Dry mouth and skin. Dry mouth is known as xerostomia. High blood sugar levels leads to dehydration. As the body tries to eliminate excess glucose, dehydration can cause a decrease in saliva production. When saliva production decreases, our mouth becomes dry. It increases the risk of dental issues such as cavities, gum disease, and oral infections. Dehydration resulting from diabetes also affects the skin. It's called xerosis. When the body is dehydrated, it prioritizes supplying water to essential organs, which can leave the skin lacking moisture. Additionally, high blood sugar levels can lead to nerve damage and poor circulation, further exacerbating dry skin. Dry skin causes itching, flakiness, and cracking. 3. Fatigue. Fatigue in diabetes is caused by fluctuating blood sugar levels, because the body's cells are not getting enough glucose for energy. Low blood sugar levels can also cause fatigue by depriving the brain and muscles of the fuel they need to function properly. In diabetes, the body's cells become resistant to the effects of insulin. This contributes to feeling of fatigue as cells are unable to efficiently utilize glucose for energy production. Diabetes is associated with sleep disturbance, such as sleep apnea, restless leg syndrome, or nocturia, which can disrupt sleep patterns and lead to fatigue. High blood sugar levels leads to increased urination. This causes dehydration if fluid intake is not adequate. Dehydration is a hallmark cause of fatigue. People with diabetes may also have other health problems like depression, anxiety, or thyroid disorders, which can contribute to fatigue. 2. Unexplained weight loss. In diabetes, the body either cannot produce enough insulin or cannot effectively use the insulin it produces. Without sufficient insulin, glucose can't enter to be used as energy. So, the body starts breaking down fat and muscle tissue for energy instead. Individuals with diabetes, excess glucose is lost through urine. It's a condition called glucosuria. This results in the loss of calories and lead to weight loss. Diabetes lead to an increased metabolic rate as the body tries to compensate for the lack of glucose entering cells. This increased metabolism can also contribute to weight loss. Unexplained weight loss can also be a symptom of other medical conditions, such as thyroid disorders, gastrointestinal diseases, or cancer. It's essential to consult a healthcare for proper evaluation and diagnosis if you experience unexplained weight loss. 1. Frequent urination. Frequent urination is medically known as polyuria. It's a hallmark symptom of diabetes. Individuals with diabetes find themselves needing to urinate more frequently than usual, sometimes even waking up multiple times. The primary reason for frequent urination is the presence of high levels of glucose in blood. The excess glucose in the urine creates an osmotic effect, drawing water from the body's tissues into the urine. This results in a larger volume of urine. The body becomes dehydrated, triggering the sensation of thirst. This leads to increased fluid intake, which can exacerbate the cycle of frequent urination and thirst. You can manage urination in diabetes by controlling blood glucose levels through medication, diet, and lifestyle modifications. By keeping blood sugar levels within target ranges, we can decrease urinary frequency. That's all for today. If you experience these symptoms, don't get tensed. It's not important that only diabetes got these signs, but if you find these symptoms in you, it's crucial to be checked up. Thanks for watching. Like, share, and subscribe for more videos.